Every part of the United Kingdom is now in lockdown, with people being urged to stay at home as the scale of the public health emergency becomes even more daunting. Such is the depth of the COVID crisis that the lockdown measures are widely expected to remain in force probably until March. Now, today's figures tell their own story. The number of new cases reported in the UK in the last 24-hour period is more than 60,000. That is for the first time since the pandemic started. In England, more than 1 million people are currently infected, and that figure is based on 1 in 50 people living in private households. But there is some progress, as more than 1.3 million people in the UK have been given the first dose of a COVID vaccine, including a quarter of all people over the age of 80 in England. Now, record numbers of people are in hospital with COVID, putting huge strain on the NHS and its resources. And the government's advisers say that some restrictions may still be needed next winter to try to keep the virus under control. Well, we'll start tonight with this report by our Deputy Political Editor, Vicky Young.
That sinking feeling. Here we go again. Across the UK, a return to deserted streets, empty classrooms and closed shops. All hopes now pinned on a speedy vaccine rollout. Until then, what will life be like? Like millions of parents, Michelle will be juggling work and helping her son with home learning.
Coming to my studio means that my son has a little bit of a break from the flat. Having him play football in the house, being away from his friends, managing technology, it's a challenge.
In Altrincham Market, all the traders are packing up again.
All the stalls are now empty. It's like going back to where it was in March of last year.
And for health workers like Naseem, it's going to be more long shifts in hospital.
A national lockdown was unfortunately necessary. My advice to all of you out there, please take it seriously. You could die from it.
No wonder the Prime Minister warned us that the next few weeks will be the hardest yet. But there was some positive news.
We've now vaccinated over 1.1 million people in England and over 1.3 million across the UK. And that includes more than 650,000 people over 80, which is 23% of all the over 80s in England.
Many think that you waited too long to bring in extra restrictions. How can they have confidence in your decision making?
It's been clear that the Tier 4 measures were something that we wanted to evaluate, and over the course of the days leading up to Sunday, clearly, like everybody else in the country, we were hoping that we would start to see some impact.
The Chief Medical Officer said the country now faced a really serious emergency.
If people don't take the stay-at-home seriously, the risk at this point in time, in the middle of winter with this new variant, is extraordinarily high. What is going to happen over time is the risk level is gradually going to decrease, and we'll then get to a point where people say this level of risk is one that society is prepared to tolerate, and lift, right down to almost no restrictions at all. We might have to bring a few in the next winter, for example.
Mr Johnson's promised to give regular updates on the progress of the vaccination programme. The aim is inoculating around 13 million people by mid-February. The Labour leader said the nation must pull together.
We now need the government to deliver for the British people. And that means using this lockdown to establish a massive, immediate and round-the-clock vaccination programme to deliver millions of doses a week by the end of this month.
Across the UK, schools are closed for most pupils and many exams cancelled. There's still uncertainty over when that will change. The First Minister of Scotland said the new strain of coronavirus had driven everything off course.
It is transmitting so much more quickly. This whole thing has always been a bit of a race with the virus. We've now got the vaccines that we hope can beat it. So we have to up our game again to try to get ahead of it. The vaccines will help us do that, but while that's happening, we need to work harder to slow it down.
The question we all want an answer to is when will these restrictions end? Boris Johnson has been guilty of over-promising in the past. Today he made it clear it all depends on how smoothly the vaccination programme is rolled out. The pressure is on. Ministers are desperate to see improvements soon, but this is going to be a gradual process. Vicky Young, BBC News, Westminster.
Well, as we heard there, the Prime Minister said that 1.3 million people across the UK have already been vaccinated, and the aim is to administer the vaccine to around 13 million people over the next 6 weeks. An unrealistic target, according to some experts. By the end of the week, there will be almost 1,000 vaccination sites up and running. And the Chief Medical Officer, Chris Whitty, says that the target is realistic in his view, but by no means easy. Our health editor, Hugh Pym, has been considering the scale of this vaccination challenge.
Vaccination is now well underway across the UK, including at this centre in Lincolnshire today. But is the process moving fast enough to meet ambitious targets? Here, they seem optimistic.
I feel extremely honoured. I'm very grateful for everyone who's worked really hard to have this vaccine available to all of us.
We feel like it's the light at the end of the tunnel, and in that vial's just a little bit of sunshine shining through. So yeah, real game changer.
The Prime Minister said 13 million people from priority groups would be offered the first dose by mid-February. Top of the list are care home residents and workers, then all aged 80 or over and frontline health and social care staff. The 75 to 79-year-old group comes next, followed by 70 to 74-year-olds and all who are clinically extremely vulnerable.
My view is that the vaccine timetable is realistic, but not easy. And the NHS is going to have to use multiple channels to get this out, but they are very determined to do this.
The vaccine made by Pfizer has been available in the UK since early December, but it needs to be stored at very low temperatures, around minus 70 degrees. The Oxford AstraZeneca jab was rolled out this week. It can be kept in normal fridges, so is easier to distribute. There are vaccine challenges. There's a process known as fill and finish, where it's put into glass vials and packaged. There is a global shortage of these vials and so delays. So far, 4 million AstraZeneca doses have been through the process. Pfizer says it's delivered several million to the UK. Each batch then has to be safety checked by the Medicines and Healthcare Products Regulatory Agency. So far, 500,000 of the AZ doses have been cleared for use. Distribution isn't easy. The NHS will soon have 1,000 vaccination centres, from GP surgeries to football stadiums. GPs say they need a bigger workforce, but there have been problems recruiting people to do the jabs.
We've got tens of thousands of recently retired GPs and practice nurses and community nurses who really want to come back and help. They go online to try to register and they find that they've got to fill out 20 plus forms. They've got to find their exam certificates, often from decades before. But at the moment, I think there's a lot of people being put off by the bureaucracy.
Sorry, I've got really cold hands.
More than 1.3 million people have so far been vaccinated in the UK. Nearly a quarter of the over 80s in England have had their jabs. But no one's in any doubt about the importance of getting millions more immunised quickly as a way out of lockdown restrictions.
Good, thank you so much.
Hugh Pym, BBC News.
Well, more than 3,000 people have been admitted to hospitals in England every day in the first few days of this year. Number of people in hospital with COVID-19 is 40% higher than in the first peak last April, and it is still rising rapidly. The pressure is intense, not least because of the number of staff off work or self-isolating. And some doctors have compared working in the NHS right now to being in a war zone. Our health correspondent Dominic Hughes has the latest.
Becky James is living with a rare form of bowel cancer. She was expecting to have surgery in the coming weeks that could cure her, but COVID pressures in London mean the hospital has had to cancel her operation. Becky understands the reasons, but it's still hard.
I feel quite helpless. I can't plan anything. That's usual with cancer. I think it leaves me in limbo, as with hundreds of other people.
I think a lot of people listening to this would be quite surprised at how magnanimous you're sounding.
I think part of it is to keep calm, because the NHS are keeping calm. So my role is to keep calm.
Across the UK, the health service is struggling. At the Grange University Hospital in Cwmbran in South Wales, staff on the intensive care unit are witnessing the very worst of the virus.
It does feel like we're fighting a losing battle with a number of patients, and constantly phoning families to tell them that they need to come in because their loved ones are really reaching the end of the line. We haven't formally crunched all the data yet, certainly anecdotally and from what I'm observing, I would say that our death rate at the moment is probably twice what it was in the first wave.
These deaths are directly related to how many people are catching the virus. In the last surge, cases started to pick up towards the end of September before peaking in November when the second lockdown had an impact. Since the start of December, infections have been on the rise again. Daily hospital admissions closely track the number of positive cases. While we have figures for England, the latest data for the whole of the UK only goes to just before Christmas. But we know that since then, cases have rocketed and admissions to hospital will follow suit. With nearly 61,000 new cases of the virus today, hospital staff are braced for some extremely difficult weeks ahead. Staff sickness isn't helping. Doctors and nurses, hospital porters and cleaners, like all of us, vulnerable to the virus. At Lincoln County Hospital, managers declared a critical incident for some hours after a sharp rise in COVID patients requiring admission. Another sign, if it was needed, that right across the UK, the virus is now fast running out of control. Dominic Hughes, BBC News.
So I've mentioned some of the official government figures a short while ago, but let's go through them all now as we do every night. And they show that there were 60,916 new coronavirus infections recorded in the latest 24-hour period. That's the first time since the pandemic started that the daily total has risen above 60,000. But testing is more widely available now compared to that first peak in the spring of last year. Now, the average number of new cases reported per day in the past week is now 55,945. 830 deaths were reported of people who died within 28 days of a positive COVID-19 test. And that means, on average, in the past week, 677 deaths were announced every day. And it takes the total number of deaths so far across the UK to 76,305. And once again, with me is Hugh Pym, our health editor. And what are you drawing from these figures today, Hugh? What would you guide viewers towards?
Well, Hugh, as well as those official figures, some pretty bleak numbers were set out at the Downing Street briefing. First of all, the UK case rate per 100,000 people up 70% in 2 weeks. And the Office for National Statistics, which does a community infection survey, suggests that 1 in 50 in England currently have the virus. That's more than 1 million people and definitely on the increase. Now, Chris Whitty, the Chief Medical Officer for England, did say that inevitably, because of more people in hospital, as we've heard, there'll be more deaths to report in the weeks ahead. There was one tiny sort of chink of light here that he talked about the new variant in the southeast and London of the virus, cases associated with that. He said maybe it tailed off a little bit. The graph had flattened slightly, but not to read too much into it. But certainly the data is going to be key in the weeks ahead as officials and all of us assess what effect these lockdown restrictions have had.
Hugh, many thanks again. Hugh Pym there, our health editor.